Bienvenido a todos. Muchas gracias por unirse hoy en
Welcome,
nuestro
everyone, and thank
webinar
you for
de
joining us
intervenciones
today
efectivas para el
on
diagnóstico
our
temprano del
webinar,
cáncer
Effective
infantil
Interventions for
y
Early
Celebración
Diagnosis of
del Día
Childhood
Internacional del Cáncer
Cancer,
Infantil este año.
celebrating the
2023
International Childhood
principalmente a
Cancer Day on
todos, Día
this
del
year.
Amor.
Happy
Es muy interna de
Valentine's Day
muchas
to
maneras.
everyone,
Gracias
the
por
day
conectarse.
full of love, and thank you
Estamos
for
dando
connecting here
algunos minutos
today.
para que
We still have a few
los colegas
minutes
sigan
left,
entrando y
so we can wait for our colleagues to join our
empezaremos. Hoy
webinar here
estamos con
today.
una agenda
We
muy
have
linda
a
y
beautiful agenda for you here today.
ah, perdón, dame. Permítanme un minuto para de compartir en cuanto les doy algunas instrucciones.
If you
Ahora
would wait
tienen
for a
el
minute,
chat
I'm going to be providing
abierto.
you
Les
with some
invitamos que
instructions. You
se
have the
presenten,
chat,
digan
it
dónde nos
is open.
acompañan.
Please introduce yourself,
Ya
tell us
veo
where
aquí
you are
present participación de
from,
toda la región.
and I
Muchas
see
gracias,
that we have people from
bienvenido.
all over the region.
Cuando
Thank you
empezaremos,
very
vamos
much.
a tener
When we
que
start,
bueno, primero también a decirles, este webinar cuenta
prior to
con
that, I want to tell you
interpretación, así
that this
que
webinar
si
has
ponen el globo,
simultaneous
pueden mirar.
interpretation.
This webinar
If you
comes with
see the
interpretation,
globe
so
at
if
the
you go
bottom
on the
where it says
globe, you can
interpretation,
open and select your language of choice. Um, and Ariana, if you can also help me mentioning that in the chat. Um, y, y cuando empezamos con las sesiones, vamos a tener
when
el
we
Q&A
start our
abierto y
meeting, we're
pueden
going to
compartirnos
have
sus comentarios y sus
our
preguntas.
Q&A, which will be
Así
open. You
que,
can share your comments
ah,
with us.
perfecto. Y excelente. Así que creo que para
Wonderful.
ahora empezaremos y
For the
me
time
da
being, I
mucho
think we're going
gusto
to start off it. I am
contar con la
delighted
participación del doctor Carlos
to
Rodríguez
have
Galindo para darnos la
Dr.
bienvenida.
Rodriguez
Él es el director
Galindo
de St.
here.
Jude Global,
He is the director
presidente
of
del
St. Jude
Departamento de
Global
Medicina Pediátrica Global
for
y vicepresidente
Global
ejecutivo de St. Jude
Pediatrics,
Children's Research Hospital. Carlos,
and he
muchas
is from
gracias por
the
estar aquí con
St.
nosotros hoy.
Jude's Children Research Hospital. Thank you for being with us here
Muchas
today.
gracias, Patricia. Muchas gracias, Patti. Muchas gracias a todos, a
Thank you,
todos
Patricia.
los
Thank you,
demás,
one
las
and
personas ya
all.
conectándose.
Over the
Así que
300
para
people
mí,
who are
quiero
here
decirles muchas
today,
gracias por darme esta
I want to
oportunidad
say
de darles
thank you
unas palabras de
for
bienvenida en
giving
estos
us
días
this
de
opportunity,
celebración del
for letting me
trabajo.
give you the opening
Conectados
remarks for
todos
our
compañeros
work.
de la
And
OPS
we are
para
all here,
recordar a
all
todos
along
los
with
niños
our
y todas las
PAHO
niñas con
colleagues. I want to
cáncer que nos
remember that
inspiran y
all
nos guían.
children
Porque todos
with
somos
childhood cancer
compañeros
are
en este
our
viaje
inspiration.
nuevo
We
que
are all
empezamos un nuevo
colleagues
día
along
en
this
nuestras vidas.
unique
Fuimos
journey. We
transformados
all
por una
started
niña
this
o un
day
niño,
when
un
we
adolescente con
all were
cáncer.
moved
Somos
by an
padres
innocent child
sobrevivientes,
who had cancer.
enfermeras,
We
trabajadores
were
sociales, médicos,
survivors,
educadores, legisladores,
children,
todos
educators,
nuestros corazones, nuestras
legislators, all of
mentes,
us,
nuestras vidas
our minds, our
enteras las
hearts,
decimos
our
dedicar a
lives.
esta labor más
We
noble
have
del
devoted them
cuidado
for
de
this
las
most
niñas y
noble
los niños con
cause,
cáncer,
taking
para
care of
crear las
these
oportunidades, las
children with cancer, to
estructuras, la
afford them
capacidad
the
para que cada una de
opportunities,
estas
the
vidas tuviera
necessary
vidas en
training, and the
dignidad
abilities so
por
that
su
every single
plenitud.
one of these
Esto es lo
lives
que
could
hoy
live their
celebramos hoy
lives fully.
con
This
la
is what we are
anticipación del
celebrating
Día
here today
Internacional del Niño con
prior to
Cáncer.
the
Estas miles de vidas
International uh,
completas que cada día florecen en nuestros países que nos
Childhood
constamos para
Cancer
ayudarles a
Day.
encontrar
We want to
los
help you here.
caminos
We are here to
de
find
curación.
you the
Y celebramos
path
también con esta
towards
misma
healing.
intensidad las
We would
oportunidades de ser
also want to
mejores, de
welcome
crear las
any
condiciones para que
opportunity
prosperen
to
los planes del
improve,
cáncer
to
infantil en
boost
nuestros países.
the
Alguien dijo, y
programs within our
repetimos
countries and
muchos
childhood cancer
científicos,
in our
lo
countries.
importante no
It
es
was
ser
also
los
said that
mejores, no
what
es
is
ser
important is not
perfectos.
to be
Lo
the
que
very
importante
best.
es
It
que
is not
seamos
about
mejores
being
en
perfect.
mejorar.
It
Y el
is to
destino
be. It's
sigue siendo
about being the
largo y el
very
camino
best in
solo lo
improving.
podemos
Otherwise,
avanzar con
the
actitud y
journey
con
will be
aprendiz.
very, very long, and we
Y
can
con eso, con
only
actitud de
move
aprendiz,
forward
me
with
enorgullece
in
hoy
a spirit
estar
of
formar
learning. And
parte de
that's what
este
we're going to
día
be
de
doing here
celebración
today.
para todos
And that's what
ustedes,
we're going to be doing
para
here
seguir
today. We are
trabajando juntos,
celebrating all of this
enseñando el
together so that
futuro
we can
para el
continue
cáncer
working
infantil en
together
las
to
Américas, con el
grapple
énfasis
and
en cómo
fight
establecer y
with
mejorar
childhood
el
cancer
diagnóstico
in
temprano
Latin
y oportuno
America
del cáncer
and the
infantil en la región.
early and
Y a lo largo de la
timely
jornada vamos a
diagnosis of
lanzar
cancer.
una nueva
And
guía
today,
interactiva para
we're
que
going to
desde
be launching
temprano,
a new
guiada
interactive
por la OPS,
guideline for
experiencias regionales
early
que han impactado
diagnosis
y en las
by
que
PAHO and
perseveran,
other guidelines
promover un
that have
trabajo
impacted
colaborativo
this
con
early
ONGs, distinguido de todos los
detection
partners y
and our
colaboradores de la
work with
región.
St. Jude
Quiero
and all the partners
agradecer
within the region. I
especialmente a todos
would
los
like
miembros
to
de la
thank
Organización
all of
Interamericana de la
our
Salud por
friends
el trabajo tan
from the
extraordinario que desde la
from
propia
PAHO
OPS y sus
for their
oficinas
commendable
nacionales
work,
y en colaboración con los equipos
their
de gobierno,
national
hospitales,
offices, the
asociaciones
governments, their
profesionales y padres de
hospitals,
pacientes que están
professional
realizando
associations,
en
and
beneficio
also
de
those
niñas,
parents who are
los niños y
reaping the
adolescentes
benefits
con cáncer
for these
y los
children at these
adultos
cancer
y a
centers
todos los
in the
países
Americas
participantes en
and
este
all those
camino.
countries
Hace ya
that
algo más de
have
5 años que
joined
nos
forces
encontramos
along
hace
this path. It's
apenas
been
unos
over
meses
5 years
y todos
and a
juntos
few
unamos las
months that
voces
we all met together.
del cáncer
We
infantil, de todos
joined
los niños y niñas
forces
con
to
cáncer del
fight
mundo,
childhood
la
cancer
Asamblea
for
General de
children
las Naciones Unidas, clamando por el derecho a ser
within the United
cuidados, no el
Nations
derecho al
and to
tratamiento,
have this
no el
right for
derecho
these
al cuidado
children
médico,
to fight
no el
cancer and
derecho
to
a
have
una
the
mejor
right for
calidad de vida,
medical
el
care,
derecho a
to
ser
have a better
cuidado, el
quality
derecho a
of
tener un
life,
futuro,
and
el
also
derecho a vivir.
to be
Y
healed, to
así
have a
fue
right
como
to a
la
future,
iniciativa
to be
global
able
contra el
to
cáncer
live.
infantil empezó,
And this
luego
is
llamada al derecho de la curación, es ahora Cure All, el trabajo que
our
estamos haciendo todos
the Global
juntos
Initiative for
y el
Childhood
camino que nos queda
Cancer
llevar
started, and we
está ya.
hope that this
Pero
path
su
will
esfuerzo va
help
a
us reach
requerir
this goal.
lo mejor de
This
cada uno de
we it
nosotros,
would
de los
require the very
gobiernos,
best
los
from every single one
legisladores,
of
los
us,
sistemas de
governments,
salud, las
legislators, the health
instituciones
systems,
médicas, las
medical
asociaciones profesionales de la
institutions,
salud,
professional
los profesionales
associations,
de la
health
salud, los
associations,
familiares, los
professional
sobrevivientes, los
health
amigos, la comunidad.
professionals,
Como
all
ya
of
lo he
us
dicho,
together,
se requiere un
the
pueblo entero
community.
para cuidar a un
You
niño con
need an
cáncer y este
entire
es el pueblo
village to
global
take care
que
of a
estamos
child
construyendo,
with
el
cancer.
pueblo de
And
las
this is what we are
Américas,
building
es una
together. We are
comunidad
building the
con
Forum of the
focos en
Americas,
todo,
which
el
is a
foco
community with a very
la comunidad donde
specific
cada uno de
focus.
nosotros
It
tiene un
is a
papel
community
concreto,
where every
pero
single
ninguno
one of us
más
plays a
importante que
pivotal
otro.
role,
Y a
and every
través de
one
esta
of us
iniciativa global
plays
para el
a
cáncer
key role. This
infantil,
initiative,
creo
this
que ya
global
23
initiative for
países
childhood
están elaborando
cancer, I
conjuntamente
think
una
that the
serie de
countries we are
políticas públicas,
developing, we are devising
planes
public
antirretrovirales del
policies
cáncer infantil en
and
las
plans
Américas.
to battle
Y desde
childhood
St. Jude, la
cancer
institución que yo
together
represento,
in the Americas, and
ha
that's what
sido
we're
y
doing
es
in
una
St. Jude's, the
inspiración poder
organization that I
trabajar con los
represented. It's
miembros
a
de la
true
OPS
honor to be
y
able to
otros
work with
ecos
our colleagues
nacionales
in PAHO and all the
en América,
national teams
Latinoamérica
as
y
well
el Caribe.
throughout Latin America and in the
Como
Caribbean.
centro colaborador de la OMS y de la
We
OPS,
are
St. Jude se ha
a
ayudado
collaborative
a
center
ayudar la
of the
implementación de la
WHO,
iniciativa
and
global
in
en
St.
los países
Jude's,
de
we have
Latinoamérica y
been
el
able to
Caribe
implement
para la
the Global
abordación de
Initiative
los
for
planes y
Childhood
las
Cancer
actividades
in Latin America and the Caribbean
implementadoras
with
de
all
nuestro
of our
programa
work.
de St. Jude
We have
Global,
been implementing it
liderado por la
with the
Fitness,
St. Jude Global,
que va
as
por
long
varias
with other
asociaciones,
associations and
miembros y
other
equipos
various
nacionales,
partners and the
en
amazing teams that we
colaboración
have
con más
throughout
de
Latin
100
America.
asociaciones en
We have been working
distintos
jointly with
150
numerous
países.
associations in all of
Y en
these
estas
various countries.
colaboraciones
With
y en
all
esas
of this
conversaciones que nos han
collaboration, all of this
nutrido a
work, and the
todos durante los
conversations that
años,
have enriched us
quiero
all
resaltar
throughout years, I
el
would wish
nacimiento de
to
la idea de la creación
underscore
de la
the
plataforma global para
idea,
el
the
acceso a
very basis
medicamentos
of
para el
creating
cáncer
Global Initiative
infantil.
for Childhood
Un trabajo
Cancer
de
and what the
amor.
initiative meant.
Hoy celebramos
This
San
is
Valentín
a work
y
of love.
diseñamos
Today
y
we're celebrating
construimos
Valentine's
con
Day
la
as we
OPS,
devise and
con
we
la
created
OMS,
along
con
with PAHO,
UNICEF y
the
con todos
WHO,
ustedes
UNICEF,
un
and
nuevo
along
hito
with
en este
all of you.
camino que
This is
recorremos
a new
juntos,
milestone in this
unidos
path that
con
we
la
are
visión
undertaking
que ya
together. We
adelantamos,
hand in
los
hand with the same
progresos
vision as
en
when
la
we
lucha
started.
contra el cáncer
We hope that
infantil
the
y en
developments in
todas las
fighting
regiones, todos los
childhood cancer
miembros,
will be able
todos
to
los
reach
equipos
all
de
of
nuestros
these
países
children
estén
in all of
organizados
our
y les
countries,
podamos dar
regardless of where
la
they may be,
esperanza y el
so
regalo
that
más
we can
único que podemos
provide and give
pensar,
them
que es la
hope, which is
oportunidad
the
de
very
vivir.
best gift that we can give
A
them, which
través de
is
la
the
plataforma
opportunity to
soñamos
live.
en facilitar
With this
acceso
platform,
ininterrumpido a
we
medicaciones
are
esenciales de calidad
providing
para todos los
ongoing
niños y niñas con
high
cáncer
quality
y que en
prescriptions
los
for
primeros
children who
5
have
años se
cancer.
pudieron
And over
identificar
the very
hasta
first
más
five
de
years, I think that we could
120.000
possibly
pacientes
benefit over
en países con recursos
120,000
limitados en todo el mundo.
children
Y
in
este aumento
limited
final del
resource
apoyo
countries throughout the
financiero
world.
nos
We are
da para
providing
ampliar
this
y
initial
levantar esta
funding
iniciativa con un
to
compromiso de inversión
launch this
de 200
initiative
millones de
with
dólares
various
por los
pledges
próximos
of
5 años.
200
Después de varios años de
million
diseño,
dollars over the next
me
5
alegra poder
years.
decirles que en esta
And it is,
semana
I'm
tan
pleased to say that
importante,
this week, which is
hoy, el día
so
de San
pivotal,
Valentín,
so
mañana, Día
paramount,
Internacional
especially
del Niño
today,
con Cáncer,
tomorrow is
los
the
primeros 6
International
países
Day of Children with
representando cada
Cancer. We
una
have
de las
all of these
regiones
projects.
de la
All of these
Organización
pilot
Mundial de la
projects
Salud
represents all of the
van a estar
regions
recibiendo
under the auspices of PAHO and to provide all of these prescriptions, all of these medicines. I think that now we are channeling this to Ecuador. I want to tell you that we are strengthening our ties with PAHO to devise a regional program that will be meeting and accommodating all of these regional programs, which is inextricably linked to our global initiative to provide all of these medicines. Along with St. Jude's, we are working hand in hand, and we hope we will be allocating $20 million in support to support PAHO and to foster the growth of this global initiative and also for the global initiative for all of these medicines. I
Cuando
feel that today
Carlos,
is perfect
el
to
primer
celebrate
país
it
de todas
on
Américas,
Valentine's Day because
está
Ecuador was
recibiendo
the
los
very
primeros
first country.
ingresos de
They're receiving the
importaciones
very first
de
shipments
calidad,
of medicine, of high
para los
quality
niños, las niñas, para
medicine
las gentes
that
en
are
cada,
without
cada
any
país.
cost for all of
Y
these
Ecuador
children who
va a
have
ser
cancer
este
in the
año El
country. But
Salvador, la
Ecuador,
segunda
after
fase, el
Ecuador, it will
piloto,
be El
apoyo más
Salvador, would
humano,
be a
más países de
pilot,
las
a project. And
Américas,
next year, there will be
más
other countries
implicados
in the Latin America who will
con
also be
anticipación a su
invited
crecimiento.
when we
Así que
reach
bienvenidos
the
todos a
stage
este
of growth.
seminario
So
virtual
welcome
para
one and
celebrar
all
el
to
Día
this
Internacional
virtual
del Cáncer
webinar to
Infantil,
celebrate the
también es una
International
celebración
Day
de
of Children with
concientificación
Cancer.
y de
And I
de seguir
think
en el
that we are going to
camino
be working
de
hard to
aprendizaje, de
continue
seguir
along this
mirando
path in
al
our learning
futuro con una
journey
mirada
and
puesta
to
en las
view the
aspiraciones que nos
future, a
marcamos
set
cuando
future, and a very
sí, la
positive one,
misma
like we started this
fortaleza
path and this
para
journey
seguir
with the same
trabajando a
strength
resolver
to
estos
continue to
retos
work
que
and
nos
to
vamos a
resolve
encontrar en el
all of and
camino
to overcome and grapple with all of these
cada año.
challenges every single day, every
Muchas
month,
gracias,
every
Pati.
single year.
Muchas gracias
As
a la
we
mejor
usually
manera de
say,
ustedes
this is the
seguir
very
creando
best way that we
en
can
estos
lay the
campos.
groundwork
Así
for
que
the
desde los
future. And that's what
cuidados
we
en
are
vivo
doing.
ya
So
termino del
from the
programa
St.
de
Jude's
Origen Global.
Hospital, I am concluded
Estamos
here, as also from the Global
comprometidos en
Initiative.
motivar
We are
este
fully
trabajo
committed
coordinado
to continue
desde
along
con
with
la
our
OMS,
work and
con
working
todos
with
los
the PAHO, the
gobiernos,
WHO,
entidades
and all
y
governments
trabajadores
and
de
all
la salud,
entities and
familiares de
all
los con
health
cáncer
workers,
de las
families,
Américas para luchar
children with
contra
cancer
estas
throughout Latin
disparidades
America to
regionales y
fight
globales
with all
en
of
el
these
acceso a
national
excelencia y
and
calidad
regional
para estos niños.
discrepancies
Espero que se
in the
sientan
highest level
orgullosos y
of quality. So
agradecidos,
please feel
agradecidos
proud.
porque
We
estamos
are
en St.
proud,
Jude formando
appreciative,
parte
and
de
thankful
estas
that from
iniciativas
St. Jude that
aquí
we
en
are
las
able to
Américas
be
y en el
part
resto
of
del
these
mundo.
initiatives
Ahorita
in
las
the Americas
cosas
and the rest of the
empiezan
world
así. Con
when
eso
so many things
les
are
doy una
starting
unas
off.
palabras
So
de
I
bienvenida,
leave
de
you now. These are my
agradecimiento y
words of welcome
espero que
and
tengamos
words
una
of
reunión muy
thanks.
provechosa.
And I
Gracias.
hope that we have the most productive meeting. Thank you very much,
Muchas
Pati.
gracias, Carlos, por sus palabras siempre
Thank you,
tan
Carlos, for your
inspiradoras.
kind
Muchas
words. You're
gracias.
so
Y entonces,
inspirational.
para
Thank you
empezar
very much. So we are
esta
going to be starting off today.
también seguir con nuestras
And we are going
pláticas
to be
y intercambios de
continue
hoy,
along with
también me
our
da mucho gusto
conversations and the
recibir a la
changes here
doctora
today.
Paula Friedrich, la
It is my pleasure
directora,
to welcome Paula
la directora del programa
Friedrich,
regional
who
para
is the
Latinoamérica
director
de la
of
Unidad
the
de
regional
Métricas
program for
y
Latin America,
Rendimiento
who will
de
be
St. Jude
providing us
Global. Paula, muchas
various
gracias por
metrics from
estar
St.
hoy.
Jude Global. Thank you very
Bienvenida
much for being here
y
today. You are
déjame.
welcome here today, and let me be able
Muchísimas
to
gracias,
share
Patti.
this.
Gracias,
Thank you
Carlos, por tus
so
palabras
much.
que, como
Thank you,
dice Patti,
Carlos, for
siempre son
your words. As
inspiradoras.
Pati says, they are so inspirational in
Muchísimas
nature.
felicidades
And
para ti, para ustedes y para
congratulations
todos los que
to
han estado
you,
trabajando
PAHO, and all
en
of you
estos
who have
grandes
been
logros
working here
serenos.
together for this amazing
Em,
achievements.
por mi parte, tengo algunas
As
diapositivas
far
que
as I see it, I have
pasaré
a few
más o menos
slides
rápido para
that I will
asegurarnos que
be
nos
going through
mantenemos en
quite
tiempo.
quickly to make sure
Pero
that
lo
we
que
keep to
queremos
our
es
time.
siempre
What I
tener
would
la
like to
posibilidad
do is to
de
always have the
conocer un poquito lo que es la
possibility
Alianza Global de
to
St.
get
Jude y
to
también
tell you
algunos de
what
los
this
avances de algunos de sus
the
proyectos.
St. Jude
Como
Global
saben,
Alliance is and some of our
la
projects. As
Alianza
you
Global de
all
St. Jude
know,
surge de lo
our
que es el corazón
alliance
de la
has been the
institución,
fruit.
el
It's the
St.
very
Jude Children's
heart of
Research
our
Hospital,
organizations, which is
y
the
esta
St.
idea de
Jude's
que
Research
ningún niño o
Hospital,
niña
and
debe
the
morir
idea
en el
that no
amanecer de su
child
vida.
should
Y esa
die
lleva esta
in the early
trayectoria
stages
que
of
nos
their
lleva
life. And
a
after
crear
this
St.
path,
Jude
this
Global,
leads us to
donde
create St.
realmente lo que
Jude's
queremos es que cada
Global.
niño
What we really want
diagnosticado
from
con
all of this
cáncer
is that
o
every
rastreado
child be
sanguíneo
diagnosed with
de un trasplante
cancer
a la sangre tenga una
and
atención de
also, or
calidad.
any blood illnesses, that they have
Nuestro
a high
modelo,
quality
¿verdad? Está
treatment.
en
What is our
programas
model
regionales.
here?
Yo soy
There are
directora
regional
del programa
programs. I am
regional
the
en
director of
Latinoamérica,
regional
pero
projects in
realmente
Latin
cada
America.
vez más
But every
trabajamos como una
single
comunidad
day and
global,
increasingly, you're working with a
donde
worldwide
trabajamos en
community.
múltiples idiomas,
We
múltiples
work
regiones,
in
con múltiples
multiple languages,
complejidades.
regions, with a lot of
Obviamente abordando
complexity.
todas las
It goes without
dimensiones
saying, we
a
are
través de los
addressing
programas
all facets
transversales
through our
que
cross-cutting
abordan
programs,
al niño con
which
cáncer que se
also
necesita,
bring on board a look
con
at the
muchísimos
children
aliados
who suffer
estratégicos,
from cancer.
muchísimas
We have a
oportunidades
lot
educativas
of
y
strategic
celebramos que ya somos
partners,
más de
educational
250
opportunities. We are
instituciones que
over
han firmado, pero muchas
250
más que están envueltas
institutions who have signed on, but
en
there are
esta
many
lucha
more who
contra el
are also
cáncer.
involved
Y desde el
in
año pasado
fighting
también
cancer.
tenemos
And since
muchísimas
last year,
fundaciones que se
we
han
also have a
sumado
lot
a
of
esta alianza.
foundations that have also been joining our
Específicamente en
alliance.
Latinoamérica, como
Specifically
mencionaba
in Latin
Carlos,
America,
ya
as
somos
Carlos was mentioning,
111
we are
hospitales,
111
instituciones médicas,
hospitals,
y aquí ven
medical
la distribución a
institutions,
través de los
and here here is the breakdown of all of the countries, as you can see. As you can see, we not only work at the institutional level, at the micro level, one-on-one, but rather every single one of the institutions, we are also working at the meso level, which are the cooperative groups, and how we can further foster this framework of these various groups that work with each other. We also work at the macro level with this initiative, which is Cure All for Latin America. We support national workshops and celebrations such as this. We we provide technical support to these countries in the implementation phase. We provide technical support in countries who are devising their national plans for cancer publications and also tools. So this growth is quite valuable because it provides a lot of support for everything in terms of our alliance and our partnership throughout the world.
In our cooperation models, we work, as I mentioned, from the perspective that we are one hospital with many tools that can generate opportunities, which will grow within a country, then within the region, then within the world. And that is one of the projects that we will mention. We have also learned to work from the macro perspective with tools that allows us to provide needed information to make the right decisions at the country level.
Y cada vez más que ver esto como un millón de proyectos, un millón de oportunidades, un millón de actividades.
Even now, looking at these many projects and many activities, we talk about that of the possibility of this cooperating projects to benefit the patient. The entire health system, the entire system of the hospital works towards benefiting children with cancer. So we start to conceptualize our initiatives from the view of the patient's journey, identifying signs and symptoms early so that we can provide a diagnosis in a timely and early manner. All the activities within the hospital when we're in the diagnosis and treatment phases, and at the same time have tools so that we can think about everything that will come later, health policies, profiles, registries, and other educational activities. And how we can improve the journey for the children with cancers from this point of view. So we are celebrating this week on Tuesday was the closing of our CMP course, Golden Hour. It's a project of expansion, started in Mexico and then has expanded throughout more countries in Central and South America. And in recent years, we have worked with 25 institutions in the maps that you can see, in the countries that you can see in this map, looking to increase the percentage of children that received antibiotics in the first few minutes. I think all of you know about the golden hour, but just in case, it's the ideal time to give the first dose of antibiotics for children that are at risk of febrile neutropenia. So it is a very critical moment, and we know that working on this particular thing, we can achieve many changes within the treatment of those children with cancer. And even though we can't necessarily treat the infection, we can do other critical steps and interventions and improve the mortality rate. So this is our story. There are 25 hospitals, 25 teams, 149 health professionals that have been working together in recent years, and we have reported 357 fever events, nights or days when families were there feeling anxious because of their child having a fever. So this is our success story. We started when only 56% of children receiving antibiotics, and now we are at 76%, and we are achieving our goal already at the start of this year. So we have expanded this project for 6 more months so that we can continue all the successes we have achieved so far. Additionally, we can see how we are decreasing the time, which is important to document as well, as a measure of progress. And finally, the clinical efficiency or effectiveness, which is reducing sepsis by 30% and increasing the transport to critical units. And as we can see, these 937 stories talk about 65 cases of intensive care units that we have avoided. And like you said, and like you can see here, 37 cases of sepsis cases that have been prevented and 22 deaths that we have prevented. So I would like to congratulate everybody who participated, which are many countries, as you saw on the map. Additionally, I can also tell you about something else we have celebrated this morning, which is using the profiling tool in Mexico, which is a dynamic evaluation of 360 degrees for health services that help all our teams and institutions with childhood cancer patients. And Mexico has been able to deliver this to all the hospitals that have patients, child patients with cancer. And it has also recruited many parts in this driving team. We have reached all these routes, and like you can see, we have already covered 80% of the way, and we are going to start realizing a process of we will start and create a comprehensive system overcoming whatever obstacles the country may have. And you can see here, we achieved 100 participants and 43 hospitals, 10 parts, 7 states. Were able to work in the first priority on the second day, which was decrease the time from suspicion to a definitive diagnosis. So we are celebrating this today, and this is for you to have an idea of the events and the projects that we have been working on. But obviously, we are celebrating with you the entire region in which we all work, and the things that we have already been seeing and the things we want to see for the coming years up until 2027. Thank you very much. Thank you, PAHO. Thank you for sharing. This is an incredible work with our regional collaborators. And I am glad that you guys are seeing some of the work we're doing in Latin America. So to continue with this celebration theme, I would like to call dear Dr. Maria Liliana Vasquez with PAHO. Thank you so much. You have the floor. Thank you, Patricia. And thank you, Paola and Carlos, for your words, for your introduction. It's very exciting to participate in this webinar. And this also allows us to pause for a minute and look at what all we have achieved and to share it with more than 600 people who have joined us today within the Americas, but also outside of the Americas, who are interested in the work that we are taking on. We must reflect on all the things we have achieved and see what else we can do, because I think the most important thing is to be united and to participate in the same conversations. So I would like to give you an overview from PAHO, and within the framework of childhood cancer, with always looking to not leave anyone behind and to achieve more opportunities for children with cancer within the regions. There are many disparities between countries still, and within each country also, regarding the treatment and diagnosis, early diagnosis for childhood cancer. From 60 to 80% of childhood cancer deaths are preventable. And this is something important to mention, because there is a range of causes that can contribute to a higher mortality rate within a country and generally in a global level. Diagnosis, misdiagnosis, no treatment, treatment abandonment, toxic deaths, and obviously relapses. All of this increase the possibility for a child or an adolescent to not make it through treatment and through a cure. So within that framework, we have worked with a joint approach from St. Jude's Children's Research Hospital, PAHO, and WHO. For us, this is more like a guideline or a global mandate, so we can work in improving the percentage of cures in children and also reducing suffering in these families. We try to reproduce this and try for all the experts within the region, obviously in Latin America, and all mentors that can provide support since we started in 2021. Obviously, the pandemic presented many challenges to our work, and we had to reach more resources. So we also need to have a strategy for treatment for these children from the institutional diagnosis to the development of public policies and monitoring these policies. How can we get them close to the patients, to the families, to health professionals, and have an impact over the whole community? This is something that I wanted to show you today in this brief presentation, to look at the strategic plan where diagnosis is a critical pillar to be able to heal these children. We have been working on this together with many of you, and we have had significant results. First, we need to consider that this is a relevant subject because we know that at a global level it's been relevant for many years, in which nearly half of the world's children and adolescents will not be diagnosed. 1 out of every 5 children may not be diagnosed because there's a confusion with diagnosis or there's no suspicion within these levels. So from 2021, with more than 130 experts at the regional level from more than 20 countries, we started collecting data from reports from WHO and PAHO so that we can intervene regarding early detection. At first we started doing it in an isolated way. There was not a space for us to share our experiences, our learned lessons, and we know more than half of the country had national regulation for early diagnosis of childhood cancer. In this regional group, we identified some important priorities, some work opportunities, mainly education, training of professionals, strengthening reference systems, telehealth or telemedicine system, and the opportunities to have an early diagnosis of childhood cancer. And these are our work pillars in this subject. Regarding education and training, we have a very important resource, which is a virtual system of diagnosis, which was published in 2021 and has more than 150,000 participants globally, and especially in the Americas region, and is available in English, Spanish, Portuguese for all of you, so that you can spread this information. It is a course that talks about not just timely diagnosis, but the initial treatment of children with cancer. And we have data, and we have been able to see that there has been an increase in basic knowledge and also in the trust that a health professional can have to detect a child that may be showing signs of cancer and take it to diagnosis. So we have all these materials from PAHO, St. Jude, CCI, St. Jude Together, and many other institutions. And we have templates, but they can be adapted for any kind of resources you might need. Liliana, can I put my hospital logos? Please do. Please translate it to your language because it's something for us that is very important at the communication level. We have seen institutions that have adapted it, that have made it their own, that have translated to 4 languages and 5 different territories. And one of the one of the approaches are the sub-regional approach, and within, for instance, the Andean Committee on Childhood Cancer, we have been reaching these regions so that we can work within these countries and obtain results with on-site workshops in border areas, vulnerable areas, and have the opportunity within these countries to create guidelines, national campaigns, and have publications. And you can actually click on this QR code and see some of the publications and some guidelines, which are very interesting. And there has been progress within public policies. In the last few years, we have tripled the number of countries that have already been working with national guidelines or regulations for timely diagnosis. So this is a very important achievement for us to continue this journey together and include childhood cancer within the political agenda of the health ministries.
No quiero hacer un spoiler porque vamos a tener 2 intervenciones muy importantes de Perú y de Panamá.
We are going to be listening to very important presentations, one from Peru and one from Panama, and how all of these public policies are going to be able to reach these children. We want to make sure that it trickles down. We want to make sure that it does impact in diagnosing our children and to do it in a timely manner, and to also decreasing these numbers. And there has been a lot of improvement in Mexico and Brazil. I think that we, as a Latin American community, it is our responsibility to strive to share all of this information and to spread all of this work as one and working as one. Now at the macro level, and there will be an event this week, and you can see the number of cases in our region are going up. There, of course, there is a greater number of cases compared to 2020 and 2022. If you remember, there was a deficit, a negative percentage in terms of the number of patients that are not diagnosed. So we hope that the number of cases will be improving since we have set this up over the last few years. We have increased the number of cases detected about 1,000. However, this has had an impact on the number of deaths. This is a small, of course, achievement for us. We are working continuously to try to leverage this opportunity in diagnosing these children. All of the work that every single one of you do in your health teams, in your hospitals, going from the initial services, your foundation, scientific communities, to be able to work together in all of these fora, all of these collaborative projects. Currently, we have 84 national projects that are being devised within the Global Initiative for Childhood Cancer. And then we have 26 in regional countries, regional projects rather, and there are 19 countries taking part, and there are 11 who have been implementing this Cure All Americas. Finally, I would like to give you the opportunity so that you can please download our national guideline. This was created since 2021. It's been over 3 years. It took us 3 years to draft this. This is a beautiful guideline, highly interactive, just
profundizar mucho
packed
más,
with links and
que
provides
por
more
primera vez
in-depth
metemos este
information.
enfoque
For the very
en
first time,
conductas
what
a
we are
seguir
doing
de
is
manera
we
muy
are
clara, qué es lo que debes hacer
focusing
cuando tienes un
in
paciente con
on
conducta
what are the
cardíaca,
guidelines that we have
conducta
to follow,
programada,
different
cuáles son,
categories, immediate treatment,
digamos,
priority
elementos
treatment,
principales que
scheduled
uno debe
treatment. What
conocer
are the
para poder sospechar
specific items that we need to
un cáncer en un niño
recognize
por
if you
cada una de las
suspect that a child
patologías.
has cancers
Hay
or every different
clasificación también por
pathologies?
sistemas, entonces
And
ustedes van a
also,
poder
it's broken down
guiarse de
by systems.
los gráficos
You
para
can
poder
also look at
tener
all of
este
these
tipo
graphs
de
to
enfoque. Y por
have
primera vez
a
también
better focus. And for
incluimos
the very first time,
indicadores en salud
we have
pública que van
also
a apoyar
included
a los
various
ministerios de salud, a
indicators that are
los
going to be supporting the
administradores
Ministry
del
of
hospital y
Health,
los equipos
the
realmente poder
hospital
medir
administrators,
este
and all of
avance,
these
cómo lo
teams to be
vamos a
able to
poder
gauge
detectar también
all
en
of this
nuestros
progress, which you're going to
indicadores.
be
Así que
hearing
agradecer
from our
infinitamente
colleagues. I
a
would like
todos
to
y cada
thank
uno de
you
los colegas que
immensely,
forman parte
every
de este
single one of our
equipo, porque
colleagues that are part
juntos
of
somos
these
siempre
teams.
mucho más fuertes y
Together, of
tenemos
course,
mejores
we are
esperanzas.
stronger together and we
Gracias y
have
adelante,
better
doctora.
opportunities to make greater headway and
Muchas
to work
gracias,
together. Thank you
Lili,
very
por
much,
compartir esta
Liliana.
que creo que es un gran
Thank you
logro de todos
for this
nosotros,
amazing
los equipos que
information. It's a
participaron, también
huge
y
achievement
también ahora
for all of
desarrollo y los
us,
equipos ahora
and also
que le van a implementar. Así
and
que
especially all those teams
estamos
that are
muy
going to be
curiosos de saber
implementing
cómo les
these
va,
programs, and
conocer
we
sus
really want to
indicadores,
know
así
how it's
que
going to work
muy
for them.
contentos
I want to hear about all of
de
their
trabajar en este
indicators,
material.
and
Y
we would like to
ahora
work with all
queremos
of this new
conocer
literature. We would
vamos a
like
abrir las
to
inquietudes un
do
poco al público
another
y
deep
queremos
dive,
conocer la experiencia
and we're going
de
to
los que están
hear the experiences in two countries
desarrollando y están
that
participando
are
otros
already seeing
equipos
the
que
achievements, the impact of all of the effort that has been made. They are working in this timely diagnosis. It is my pleasure to invite Dr. Karina Quintero, who is the National Coordinator of Children and Teenagers with Cancer in Panama. She's going to be talking about her work and the experiences. Thank you very much, Karina, and you have the floor. Thank you so much for this opportunity to be able to share with all of you all of the experiences that we have had throughout this journey. As Carlo, Liliana, and Paula have mentioned, this has been a journey that we have all been on together. And here, this is one of the very first points that we have been focusing on. I am referring to how we're going to be gauging all of this. Of course, it goes without saying we had the death rates where that we always needed to pay attention to the deaths of children and teenagers, and this was the primary cause of the death of the children between 5 and 19 years of age. In Panama, this was our starting point, and this was a point that we really needed to focus on and how we could drop this death rate. Here are some numbers so that you can get an idea in terms of what's happening in Panama. Currently, we are 6 hospitals and we are providing this care with children with cancer. 2 of them are focusing on teenagers, more specifically between 15 to 18 years of age, and then the others are under 15 years. Now, approximately 169 new children were diagnosed with cancer every single day between the age bracket of 0 to 19 years of age, and this goes hand in hand with our national cancer registry. 77% of our children have now been registered and have been reported now. In terms our capabilities to resolve all of these issues, we have a limited capacity in light of the fact that we have very little staff. Since Panama is a very small country, we currently have 13 hematologists, pediatricians rather, and that are giving care. We have, and also 6 pediatric oncologists. We have 165 children that complete all of the treatments. What this means is the vast majority of these children are actually carrying out their programs to fruition. And there's also what I would say we need to boost and improve our registries within the hospitals. Only 20% of these children are actually registered in a hospital system. One of the major achievements, let's say in 2019, we were able to include pediatric cancer in the very first first national plan to battle cancer in children in our country in 2020. We were able to draft the very first laws focusing on childhood cancer in Panama. And we were to provide and giving the opportunity to all of these parents, and I'm referring to give them the national the necessary time for them to be able to take off, especially for those children that are receiving the treatment. And finally, in 2021, we focused in timely diagnosis. Here are the number of cases that we have year on year, and the data that we have in our National Cancer Registry. We provide services to almost 68% of the cases of children who are under 15 years of age. Here is our timeline. We have been working in terms of our national plan and the Commission of Pediatric Cancer, and what we have worked about all of the work that has been undertaken through PAHO and St. Jude's. And you can see the entire line up above has been supported with all the PAHO, WHO, St. Jude's, all of our partners, and we have been working hand in hand through all of the frameworks which have been devised at the national level. We have developed strategies. We have also included some strategies at the regional level. We have been working with various groups in Central America. We have also worked with our partners, our Central American countries and South American countries. Throughout these years, we have been working and devising these guidelines for timely diagnosis as the prioritized objectives of the Commission for Children and Teenagers with Cancer. What we have devised, these guidelines for timely diagnosis, we have boosted their abilities online and on site. We have numerous activities at the national level, marketing campaigns, through various NGOs. All of this has been underscored when we started this work in 2021. We have also addressed coverage laws, treatment laws as well. And this is what's going to truly help us to gauge the impact we are having in all of the various solutions and measures which we are providing. Panama, as Liliana also said, we also took some of the guidelines and we customized it. We made them our own Panamanian with a little Panamanian sauce, if you will. This has been joint work together with our health personnel that has to do with managing these children with cancer. And we devised this guideline for the early detection and timely provision of services or the suspecting of children who or teenagers who have cancer. This was published in their official gazette in 2021. As I told you, this guideline also included cancer statistics at the national and at the worldwide level. And it also provided the various signs and symptoms of children and teenagers, the most common ones, and also assessment of the AIEPI strategy in the various categories red, yellow, and green to be able to refer them better and in a more effective way to the various health systems. So we started our training with our primary care personnel. We carried out an on-site training. There were over 1,000 team members that joined us here in Panama to train also other trainers in 15 regions of the Ministry of Health and Social Security as well. These are the two that we are working with in our provinces in Panama, Chiriquí, that is approximately 7 hours away from the capital, and Baraguas and Asuero. And so what we did is we devised all of the methodology so that it would have a trickle effect from all of these trainers. We also created a lot of AV materials. We were able to create a virtual course for 6 modules, along with all of the guidelines and a flow chart. It was didactical in nature to support all of the health personnel, to support all of these patients. We also had the backing, for example, the Panamanian Society of Pediatrics that supported this guideline along with us. And there were various national campaigns, such as timely diagnosis through various organizations, the Ministry of Health, MINSA, And as of September, and also we also did this in February, we did this throughout Panama, all of these endeavors. Some of the outputs here and what we are celebrating here, for us, we are so excited about this. We are enthralled and we are just so proud to be able to tell every single one of you to tell you about our own experience. I would say that this has guided our ability to be able to have a children that have earlier with earlier stages and earlier stays. We have all of this that we started this in 2020 and 2020 we had early stages were detected 11% between stage 1 and 2, and the most advanced stages were almost at 89%, 3 and 4. In 2021, we tried to improve somewhat, and we explained this a bit in light of the fact that we are a rather small country. And to when the pandemic hit, although it might not seem real, we did have opportunity to resolve this because we had fewer cases and we that came into our ERs, and we were actually able to diagnose them and to speed up these diagnosis times for all of these children. And then we also saw with the diagnosis guidelines for timely diagnosis, we were able to see that there was a turn we pivoted, if you will, in terms of the number of the children that we were registering. We would see that stage 1 and 2 were on the rise up to even 41% in 2022. And by 2023, they had increased up to stage 1 and 2, 65% in 2024. We were able to record that there were 72% of children that were in stage 1 and 2, which were very early stages. So what this means that we give them a greater chance for life of these children that are at stage 1 and 2 at earlier stages, and we can also are able to have a greater opportunity to heal them at these stages. As far as we see it, this is a huge achievement and a reason for us to celebrate. I think that we also need to think about that there are so many other things that we're going to be able to do that we're also going to be able to work together on, and we can work hand in hand. And we were gauging all of these timelines, the diagnosis times, from the moment in time that the children are going to be coming in when we first suspect that they have this and they go to the very first doctor. And this is also, we note, or if there's a delay with the family, we gauge and monitor the times, the reaction times for the doctors when they do this diagnosis and the total diagnosis time. And we were able to see that this has a lot of variations over these years. And over these times, we have not been, we wanted to see if we had any impact on all of this. And this has a lot to do with our capabilities to resolve all of these issues. We know that we need to continue working on together. It's not the time for us to say, well, we have this huge percentage, we are all happy about it. But no, this is not the time to just remain stagnant in a rut. It is a time to keep on working, to continue moving forward with new plans. So there we have a lot on our plate. Here's our to-do checklist. And what we do is we think about things once again. We have done this with the PAHO's help and St. Jude's help. We did a profile work in March of 2024. We were able to underscore 3 areas that we would further like to boost, our specifically in terms of the services that we provide, would be integrating hospital and our population registries and decreasing the time in administering antibiotics and awareness raising regarding pediatric cancer to try to decrease the death rates for all of these children once they have been diagnosed with cancers, once they have received all of the treatment through chemotherapy. And this is also awareness raising regarding pediatric cancer. Now, the virtual courses, this is a platform that has been incredibly useful for all of us. And I'm referring at the national level in Panama to be able to record and to understand who are the people within our health systems that were able to be trained and to be able to understand how many more we need, how many more people do we need to reach to be able to carry out national campaign regarding timely diagnosis and to also set various coverage programs to include children and teenagers in the age bracket 15 to 18 years of age. So I think this would be incredibly beneficial to be able to use, and the global platform for medication, to be able to have this capability to respond, to be able to boost our numbers. Thank you for listening. Thank you very much, Karina. You have a large number of achievements. Congratulations. So many interesting points that we are able to learn from your experience. Thank you so much for sharing all of this. It is an honor to be able to continue working with you and to continue to further expand these results. You can see we have a slew of comments and reactions that we are seeing, and thank you for all of their contributions.
Now I would like to give the floor to Dr. Essie Maradiegue, who is the Executive Director of Cancer Prevention in the Ministry of Health in Peru, so she can let us know what the impact of these strategies have been in Peru. So Essie, thank you very much. Welcome. Thank you. And thank you for being here. I think that we are achieving many things together. So a big hug from Peru to all of you. I would like to say first that in Peru, as many countries in the region, there are many obstacles for treatment of childhood cancer, inequality of treatment and specialized services, access to treatment centers, long wait times, lack of trained health personnel, economic difficulties for families. And obviously, all these costs have increased. These obstacles, we know that can end up in unfavorable results within treatments and health treatments. In the last 6 years, thanks to the support of PAHO, WHO, and St. Jude, we have been able to consolidate a strategy. And as you can see, we have identified 4 aspects. One of them, educational, with training, creating educational materials, awareness, and use of information technology. This strategy has been developed and has been consolidated in recent years. Within regulation, we have a national early detection guide, which is supported by our urgent medicine law for childhood and adolescent cancer. And we have just approved a law which reduced the diagnosis time for tumors, both solid and leukemia in children and adolescents. We know that within the adult population, this is something different, is around 65 days, but for children and adolescents, for solid tumors, is less than 31 days. So I think this is an important milestone, at least in our country. We have also realized different trainings. As my colleague in Panama was talking about, we have followed the training model. We have done more than 10,000 on-site trainings within this method, and we've also done virtual trainings aimed for medical personnel and experts. And we have also included teachers, journalists, authorities, all people that can benefit from this, like leadership. And we have had the support of PAHO with many aspects of it, including languages, including sign language. We have also done many communication campaigns. We have developed some videos, not just for diagnosis, but also within the framework of the follow-up of children with cancer and avoid relapses. We have also been able to use information technology through our model to shorten the diagnosis times and have a timely diagnosis, and we have also developed several platforms. The interesting thing about this is that this was a trickle-down effect within our health systems in the country, and we have also started developing platforms such as Teleeduca and Social Security, and this has allowed us to improve these numbers for early detection. Currently, we are developing another telemedicine tool to improve appointments with health professional. And here I wanted to show you some of the results. And we have decreased the diagnosis time after implementing this early detection strategy within the global framework. And it's a very big statistical difference, as you can see in the blue boxes. And in this way, we can also achieve a very big change within the red box. This change is the training and the strategies aimed to health professional, which has really motivated us and given us new air to continue. And something worth to note is also the sum of actors and actions that have allowed us to consolidate this strategy within regulations, training, awareness campaigns, and the use of information technology together with everyone's cooperation. So thanks to these efforts, we have been able to work with the country's inner regions within a south-to-south cooperation in early detection. In closing, I would also like to do a call for action on behalf of all the children in the region for us to continue working together. And we know that this strategy has had great impacts involving many actors from authorities to teachers, and it has resulted also in a cost-effective strategy. Thank you. Many, many thanks, Essie, for sharing your experiences. Congratulations on all your achievements. I think something that we can see in your experience with Panama is the importance of the involvement of many parts. I think this has been very didactic. Thank you so much. And something that I'm personally proud of is that this communication within South America in creating this framework and extending it. We have also been developing publications regarding this cooperation, how we can achieve this model, and I think it can be used later in different regions. So it will not only be our region, it'll be other regions. I thank you again. Like we always say, it's a work for everyone. It's work for everyone. Okay, now I would like to share with you a video. It's very short. I know we are almost at the end, but we wanted to share this video that will
Childhood cancer impacts thousands of children year on year, causing anguish and suffering in the Americas. Governments, PAHO, and its partners have joined forces under the Cure All initiative to grapple with this challenge and to provide hope. Since 2019, PAHO, along with St. Jude's Children Research Hospital, we are working in we are steadfast in improving timely and early detection. Latin America and the Caribbean, we are making sure that a greater number of countries prioritize childhood cancer, including them in public policies to foster timely diagnosis. Over the last 5 years, we have at least tripled the number of countries that have a national guidelines for early detection and referral systems. We have already seen the very first results and outputs so that these children are able to get there early for their diagnosis. A greater number of children can also be caught at the early stages, and they have a greater chance of being cured. In Peru, we have managed to decrease by half the diagnosis time over 5 years. Mainly, this is based on the World Initiative on Childhood Cancer, the time in which all of health professionals, doctors, and nurses, they would take time to carry out diagnosis in children or those that they suspected had cancers. We have significantly reduced these numbers. Currently, children and teenagers are coming in faster to these health institutions. This achievement has been a joint work with the Ministry of Health through public policies that drive the early detection of childhood cancer and also boosting the skill sets of awareness raising within their community, timely diagnosis, and it goes without saying, the engagement of organized civil society. We have been able to drop by 50% the number of the cases of advanced stages in cancer. This means that a greater number of children receive an early diagnosis and a greater number of children have a better chance to live. We educate, we raise awareness to our staff and the population as a whole. The Pan American Health Organization endows all of these countries with the various technical resources, virtual on-site workshops, interactive guides to boost the training for all of these health professionals, as well as literature, communication campaigns that are geared towards parents and to the community as a whole. Through Cure All Americas, we are also supporting the governments in sustainable monitoring and standardized monitoring, and also implementing their health policies, which boost the access to early diagnosis, treatment, and financial coverage, with one goal to have an early diagnosis that saves lives and to improve the lives of our families and communities. Every single intervention by public health, coordinated effort, all of these are steps towards a future where there is a greater number of children that can overcome cancer. And early diagnosis saves lives, saves lives.
Muchas gracias.
Thank you very much. And thank you all once again for taking part here today. Regrettably, this was so wonderful and so interesting. I'm always learning. And as I said, we are now have to close our conversation today. I would like to ask Dr. Mauricio Massa, who is the Regional Advisor for the Prevention and the Control of Cancer from the Pan American Health Organization. I would like him to make his closing remarks today. Mauricio, thank you very much.
Thank you very much, Patty, for moderating this excellent session today. And thanks, Carlos, for your opening remarks. For us, in PAHO, it's an honor to be a part of this global movement. We are very happy today to be just a small part of all these stories that were shared today. To see how many people can unite to help children with cancer is something that fills us with happiness. As Paula said, to better the system, save lives, we must change national policies for health, and this can also save lives. But this can only happen if when it goes from an idea on paper to an action. As I always say, we can have tens of thousands of documents, but if we don't have action, then those documents are worthless. And that also requires political will. And as we saw the doctor from Panama presenting, this is the number one cause of death of children from 0 to 19 years. What can we do? And then they report that they have a high percentage of treatment. What can we do? What kind of initiatives can we do all these documents that Cure All has generated is something that has helped, and it makes me very happy. But you could see this timeline that she showed, and those of us who work in public health, we know that there are initiatives that can create this impact in the short term. But to solve big issues and to be able and to ensure that this is sustainable, we have to have more components. How can we improve from early detection to access to medications? And Essie's presentation with all the obstacles, the limits to access, economic obstacle, but also applying a strategy with regulations, awareness, technology. She talked about how all these guidelines changed. And this again shows us it's about actions, concrete actions, online courses. Fortunately, we have 19 countries in our region who are part of Cure All Americas, and 14 of those already have national plans for childhood cancer. So I think that the message I would like to leave you with is that we can start this phase of action. We must go from paper, from guidelines to action, so that we can see more early diagnosis, which isn't easy, but we know that it's possible. It's easy to detect it early. It's easy to decrease the action times. It is possible to increase access to medications. It's something that we're looking and we're seeing thanks to the actions of all the people present here today who have been a part of this. So I would like to thank the more than 700 people that have connected today. I know that you will help us spread this message so that we can achieve all our goals and help all the children with cancer in the region. Thank you so much for being with us today. Thank you. Thank you, everyone. Wonderful St. Valentine's Day, wonderful International Childhood Cancer Day tomorrow. Thank you for celebrating with us this month.